will have the next set of questions, and she will chair the committee, and Senator Whitehouse will be the ranking member while Senator Murray and I go to the floor. Senator Collins.
Thank you, Mr. Chairman. You know how much I love having the gavel in my hand.
He's not going to give it to you easy.
As Dr. Wen mentioned, law enforcement officials throughout our country are often on the front lines of this epidemic. The sheriff of Penobscot County in Maine tells me that the intake room of his jail often resembles an emergency room between the number of people who are drug addicted or who have untreated mental illness. In Western Maine, a police chief is spearheading a program called Project Save Me, and it's actually modeled after the ANGEL program, which was started in Gloucester, Massachusetts. The idea behind this program is to encourage addicts to come to the police department, turn in their drugs and their drug paraphernalia, and then get connected with a counselor who can get them on a treatment path. They won't be arrested, but instead they'll be paired with an individual who can help them begin facing their addiction. And other towns in Maine are also testing this model. You each bring very different perspectives to this crisis, and I would be interested in hearing from each of you what more you think that we could do at the federal level, at the state level, local level, to bring law enforcement and treatment options together. Because it's clear that you can't arrest your way out of this problem, and yet it's law enforcement that is having to deal with it in many cases. So I'd like to start with you, Mr. Spofford, and then just go down.
Sure. I think any efforts to support similar programs as the one in Gloucester and in Maine are excellent. I think the treatment community and law enforcement have been a part of that. I know a lot of those folks have done a real good job on their own of trying to make this happen, but perhaps some official policy behind it, not just the good wishes of several police captains, or chiefs rather. Another thing I think is incredibly important is, believe it or not, as you probably know, the largest treatment center for substance abuse folks in the country is our Department of Corrections, with statistics of 85% of incarcerated people having substance use disorders. And the money behind that, I mean, from a fiscal standpoint of an average of $48,000 to $52,000 a year to incarcerate them, with almost very minimal and almost no rehabilitative services for these folks getting out. You know, you take an addict and you lock them up for 6 months, 1, 5, or 10 years. When they get out, they will still be an addict. And if they're not in a process of recovery, they will behave and act in the same ways that they always have. So implementing some sort of policy to bring treatment solutions into our jails and our prisons to prevent these people from coming back and to getting out and being productive members of society and productive members of the recovery community is incredibly important.
Thank you very much. Dr. Valak.
Thank you, Senator Collins. We in Colorado have been piloting various ways to engage law enforcement into the mix of solutions that we're crafting. One of the ways we're doing that is to expand take back of unused prescription drugs. We think this is particularly important given data that suggests between 70 and 73% of people who misuse prescription opioid painkillers start with a prescription drug they obtain from a friend or family member's medicine cabinet. So we view this as low-hanging fruit that we must clear out unused opioids from the medicine cabinets of all citizens And most people's fear is that they won't be able to get enough opioids, so they'll save it, when in fact they may have the opposite problem. They might have too easy a time getting more. So we think taking those drugs back and disposing of them properly is one of the major things that needs to happen.
Thank you. Dr. Nguyen.
3 concepts, Senator Collins, for working with law enforcement. The first is making sure that we have no round-door policies for seeking care and increasing diversion programs, for example, pre-arrest diversion into treatment rather than incarceration. The second is if somebody is incarcerated, I completely agree that we need to be able to provide them with the care that they need. Yet in Maryland, just like across the country, if somebody is stably maintained on methadone or buprenorphine, we often are not able to keep them on these medications, which again, we would never do for any disease. No medical society would condone stopping insulin, and no medical society condones stopping methadone or buprenorphine when somebody is already on those medications, yet that often happens in our correctional system. And the third is that for people leaving our jails, these are people who are the most vulnerable. Many of them have lost their health insurance. They need help. They need case management to get them connected with medical treatment, psychiatric treatment, with addiction treatment, and also with housing. So I'd say that those are the main things to work together with the law enforcement colleagues.
Thank you very much. Senator Mikulski.
Thank you, Senator.